So what first drew me to medicine was orthopedics before I even knew what orthopedics was. They showed a knee replacement on television. And I sat there at 15 years old and said, I can do that. I have those tools in my garage. And I always liked myself to be a very blue-collar guy from a blue-collar background. I liked building things. I liked fixing things. And it's very satisfying. That's what we do during the surgery so that you can leave a surgery and say, you know what, that looks pretty. That looks beautiful. But then when they come back and they say, this was amazing, that's really what drives me to do what I do. Communication is probably the most important thing that we do in medicine. And it's probably also the biggest shortcoming that many physicians have, particularly surgeons. So when you come to me, I'm going to treat you like family. I'm going to give you the same advice that I would give to my brother, my mother, or my sister. Oftentimes they've been misdiagnosed, overdiagnosed, or underdiagnosed. So the first key is to really hone in on what's causing the patient's pain. What is it on an MRI that I see relates to this patient's specific complaints? Then, based on matching those two things, discuss with the patient, these are the options. And these are the options not because this is just my experience and this is what I've done in the past that's worked. This is the literature. These are the data on these different options. I distill it down for a patient so that they can hear the pros and the cons and make up their minds and choose a treatment choice together with me. There are a few cases where I still have patients who send me years after their procedure thank you cards. I'm still doing X, Y, and Z. Thank you for changing my life. Oftentimes, very routine procedures. You know, it's not the most complicated problem that a patient can have in order to get such a tremendous benefit from the operation. So those are the ones that really stand out in my mind.